start off by saying thank you. And as we start off with every video, we'll give you about 10 seconds to get your notifications. Mom is doing better. She had a stroke, but she is recovering and heading towards rehab. So again, thank you. And today's video, we're going to be discussing how to care for a patient after a cardiac arrest event. And we'll get started in 10 seconds. All right, so let's start with our introduction. So during the night shift, Mr. Doe experienced a cardiac arrest event. He received 4 minutes of CPR and 2 shocks with an AED. You are the CNA or patient care tech, PCT, that's working in the ICU, and you are assigned to care for Mr. Doe. And here's a little bit of the background. Mr. Doe is 65 years of age. He was admitted to the hospital with complaints of chest pain, shortness of breath, and fatigue, which are all signs of cardiovascular disease. He was initially stabilized in the emergency room and then transferred to the ICU or the cardiac care unit. During the night shift, he experienced a cardiac arrest event, and you are the CNA, or the hospital term for a CNA is a PCT, patient care tech. You are the patient care tech who found him unresponsive during your rounds. This is going to be our case progression. And of course, we have questions embedded throughout the case. So the initial response, basic life support, post-resuscitative care, and then also patient and family education. As a CNA or a patient care tech, what is the first thing you should do when you find Mr. Doe is unresponsive? Is it A, call for help, B, check for a pulse, C, start chest compressions, or D, open his airway? You have a patient who is unresponsive. What do you do first? And good morning, Michelina. If you chose A, call for help, you are absolutely correct. So whenever someone's unresponsive, you don't need to know the reason why. You need to get help. So ensuring that additional help is on the way is the first priority in managing the care for a patient who is unresponsive. After calling for help, what is the next step? So you've called for help, you've pressed that code button. Is it A, give 2 rescue breaths, B, open the airway, C, check for a pulse, or D, check for responsiveness? I see some C's. I see a lot of C's. And for this one, I know you want it to be C because we know the case is about cardiac arrest, but it's supposed to be D. Check confirming that the patient is unresponsive guides the steps for the BLS protocol. So, but yes, after checking for responsiveness, you would definitely feel for a pulse. But how long do you feel for a pulse? Is it 5 seconds, 10 seconds, 15 seconds, or 20 seconds? And I want to tell you about one of the patient care techs who was taking care of my mom. It was her second day on the job, you all. She was a transporter in the hospital. And when I come in, rapid response team is surrounding my mom. It's like the 3rd time rapid response has been called on her. And the patient care tech said, I didn't know what else to do. She was just having difficulties. So I notified the nurse. And so once mom was stabilized, I worked with that patient care tech. I taught her how to turn mom, how to clean her perineal area, because I made sure I explained to her that in this case, her being able to alert the staff that, a patient was in distress was more important than her skills. So day 2, she's taking care of critical patients. She was nervous, but she was teachable. And I was able to teach her new skills at the bedside. So it just reconfirmed the reason why we need to keep having all these videos and teaching you all online, because you just never know who that new patient care tech or that new CNA is going to be, who could be taking care of your parents or your grandparents. So I just want to thank you all for all that you do, because I know that these patients are going to be receiving wonderful care. And for this question, if you chose B, 10 seconds. You are absolutely correct. So checking the pulse for no more than 10 seconds. That's going to avoid delays in starting chest compressions. And notice where the person's fingers are placed. They're placed on a carotid artery. And whenever you're feeling for a pulse, remember, you're not supposed to feel for a pulse with your thumb because your thumb has its own pulse. You can use 2 or 3 fingers according to most standards, but just not the thumb. All right, so now we have CPR in progress. Mr. Doe's receiving CPR because he had a wonderful CNA, patient care tech. She alerted the staff. She found him unresponsive. She checked for the pulse. Right now, she's in the room by herself. What is the ratio of compressions to breaths? Is it 15 to 1, 15 to 2, 30 to 1, or 30 to 2? CPR is in progress. You're in the room by yourself. The team hasn't showed up yet. I think I see some correct answers coming through. If you chose D, you are absolutely correct. So great job, Ruth. Great job, Jane. Yes. So for single rescuers, all ages, whether it's adults, children, or infants, the recommended ratio is 30 compressions followed by 2 breaths. If you don't have your pocket mask there, you just keep doing hands-only CPR until your team comes with equipment, and that is when we can do 30 compressions followed by 2 breaths. Remember, for a hospital or medical setting, you're not doing mouth to mouth on your patients. You have to wait until some type of resuscitative equipment comes so that you can deliver those breaths, but you don't delay your chest compressions. Question number 5. What is the recommended depth for chest compressions in adults? Is it 1 inch, 2 inches, 3 inches, or 4 inches? We're saving lives today, team. How deeply do we want to compress? Revealing the answer in 3, 2, and Ruth Ann and Wesley, you all have it. It was B, 2 inches. So you want to compress at least 2 inches. And let me preference that at least, because if you're on a bariatric unit, let's see where my camera is. If you're on a bariatric unit and that patient is obese, they're 400 pounds, you can't be compressing 2 inches. I need you to compress deeper. That's when you compress 1/3 the side view of their chest. So for an adult, it's going to be 2 inches, 5 centimeters, or 1/3. Because if they're really big, compressing 2 inches just wouldn't be sufficient enough to get to that heart. All right, so how often should you deliver breaths during CPR? So this is for somebody who's intubated. If they have a tube, a breathing tube, or a tracheostomy, do you want to deliver a breath every 3 seconds, every 5 seconds, every 6 seconds, or every 10 seconds? You're in the ICU. Mr. Doe is now intubated. He's in cardiac arrest. Respiratory should deliver a breath how frequently? And for this one, I want you to make note of it. It is every 6 seconds. So on average, the victim will receive about 10 breaths per minute. And this says when the airway, advanced airway is not in place, but it doesn't matter whether advanced airway is in place or not. If we're given the rescue breaths while we're doing CPR, it's going to be 1 breath every 6 seconds. And that'll make more sense when you're actually in the ICU area and you see somebody who is being resuscitated, who has a trach and or who is intubated. Question number 7. If an AED is available, what is the first step in using it? And remember, we're going through this whole progression. You found him, we're going to save him, and we're going to discharge him, but we have to work our way all the way through to the end. So the AED just came in. Are you going to do A, place the pads, B, turn it on, C, analyze the rhythm, or D, deliver the shock? First things first. And if you're like Mary and you chose B, absolutely, you got to turn it on. It talks to you, it is voice guided. So the first step is to turn on the AED and then you follow the prompts. And here we have a picture of the pads. The pads show the placement. So it's usually going to be high right and low left. When we say low left, don't place it on the stomach. Place it a little bit below the crease of the breast. That's near the apex or the strongest part of the heart. Oh, Mr. Doe is receiving great care. If you need a refresher on CPR, I do have a video on my YouTube channel that's just going to talk you through everything we're doing right now so that you would be aware of how to save an adult, child, or an infant. Let's continue, team. Number 8, what action should be taken immediately after a shock is delivered by the AED? Do you check for a pulse? Do you give 2 rescue breaths? Do you resume chest compressions or do you wait for the AED to analyze? So the AED, when it shocks the heart, it sends energy through the heart, through the chest wall to get to the heart, to hopefully put the heart in a normal rhythm. But even if the rhythm is normalized, it's not sufficient to sustain life immediately. So after the AED delivers a shock, what I need you to do is to resume your chest compressions. Yes, because it shocked the heart. The rhythm may be normal, but the heart rate could be too. So I need you on top of that chest, continuing those chest compressions. And chest compression should be resumed immediately after a shock is delivered to maintain circulation. There is no residual charge. So once we deliver that shock, remember before we press the shock button, we clear everybody. So once everybody's clear, we press that shock button, we go right back on that chest until we have signs of life or until our next 2-minute round. We usually cycle out every 2 minutes, and that's when we'll do our next pulse check. Great job, team. Guess what? After 2 shocks, Mr. Doe has a pulse. I am so proud of us. We did wonderful. All right, so now post-resuscitation care. What is the primary goal of post-resuscitation care? Is it A, prepare the patient for discharge, B, perform diagnostic tests, C, administer medications, or D, stabilize the patient's condition? Because after someone is brought back after cardiac arrest, we're still not happy. We're very concerned because we don't know what caused them to go into a cardiac arrest state. So, what do you think is the best way? How do we provide care for them after an arrest? Yes, Arnell. Yes, Wesley. Yes, Jane. We have to stabilize their condition, Lord. We have to prevent another arrest. And so, what my wonderful CNAs do are you're like the runners, you're getting equipment, you're making sure the vital sign machine, hey, it's probably going to be set for every 2 minutes. So, you have a role in there, you're monitoring them. So, post resuscitation care focuses on stabilizing the patient and preventing further complications, because just because we got their heart restarted again, when we say that we code someone twice or that we coded a patient 3 times, that means their heart started beating again, it stopped. We shocked them, we did our CPR, we get it back again, it stopped. And that's going to continue happening until they can find the cause for the arrest. What is causing this person's heart to keep going into an abnormal rhythm? So, CNA, patient care tech, which vital sign is most critical to monitor continuously post resuscitation? And I know you want to say all of them, but is it blood pressure, heart rate, oxygen saturation, or temperature? And for this, I need you to remember the ABCs of nursing. The ABCs of nursing. When someone has a pulse, what do we focus on more so? Let me do my crazy nurse dance. Mary, and then Mary spelled a different way. Oxygen saturation. That is right. ABCs. When someone has a pulse, ABC is airway, breathing, circulation. So, your job right now, yes, we're monitoring all the vital signs, but usually an early indication of something going wrong with that patient is going to be that oxygen saturation. So, continuous monitoring of oxygen saturation ensures adequate oxygenation, which is crucial after cardiac arrest. Remember, the heart's not pumping properly. The heart pumps blood. Oxygen is carried in the blood. So when they have a heart problem, they can also start having changes in their saturations too. Oh, you all are working hard today taking care of Mr. Doe. Number 11, what is an important aspect of care for a patient who has just been resuscitated? A, encouraging ambulation. B, providing emotional support. C, ensuring adequate rest. Or D, assessing neurological status. Don't get tricked. Don't get tricked. When someone's sick, we're not focusing on emotional support right then. We're focusing on stabilizing them. I don't see the right answer yet. Revealing the answer in 3, 2, and their neurological status, you all. So remember, when someone has a change in condition, remember when he was unresponsive, he may still be unresponsive. So, yes, we want to provide comfort to them. We want to make sure they're not in pain. But if they're not responding to you and now they have a pulse, that means that we can possibly, they could possibly be a candidate for what we call targeted temperature management. We keep their body cold. And so, what you see there is an example of what they call like a cooling blanket, a bear hugger. It's going to lower their body temperature so that the brain doesn't have to work so hard, because after not having perfusion to the brain, on its own, we did it with CPR, but there could be some brain damage there. So that's why the level of consciousness, you monitoring that patient for neurological changes, is going to be so important. And so the response was D. That was the correct response. Evaluating the patient's neurological status is essential to determine the impact of the cardiac arrest and resuscitation. Number 12, why is it important to monitor the patients for signs of recurrent cardiac arrest? A, to adjust the treatment plan. B, to inform the family. C, to document the patient's condition. D, to provide early intervention if needed. CNAs and PCTs who monitor patients who notify nurses save lives. So, what are you monitoring? What are you doing after we get someone's heart restarted? Why do we have you doing all this monitoring? DeLipt and Wesley? Yes, it is D, because we got to make sure that they don't rearrest. So, yes, we have to provide early intervention if needed. So, when you're monitoring them, you're monitoring for signs of recurrent cardiac arrest. And this allows for timely intervention to prevent another episode. Like I was telling you about the patient care tech, she didn't know what was going on with my mom, but she noticed a change. And my mom had a whole monitor on, supposed to be monitored at the desk. The people at the desk didn't notice the change. The person in the room, her CNA, her PCT noticed the change. And then that's how they were able to help, get my mom back into a better condition. So you keep monitoring those patients and notify the nurse if there is a change. Worst thing the nurse can do is explain to you what's happening, but you keep monitoring and documenting anyway. 13, what role does the nursing assistant play in post-resuscitation care? Do you administer medications, perform diagnostic tests, provide basic care and monitoring, or decide on discharge plans? And you should get this one right. There's no reason for you to get this one wrong. And so I'll reveal the answer in 3, 2, and yes, Mary. Yes, Arnell. Yes, Wesley. Basic care and monitoring. The correct response is C. So monitoring for signs of recurrent cardiac arrest. Oh, that's the wrong response, but you get it. You got to keep providing that basic care and monitoring them. Now it's almost time to get Mr. Doe out of the hospital. He's been with us now for 3 days. He's recovered. He can now speak and he can eat. So, 14. What is an important topic to educate the patient and family about after cardiac arrest? A, the cause of the cardiac arrest. B, the side effects of medications. And this is coming from a CNA standpoint, not a nursing standpoint. C, the importance of follow-up care. Or D, the hospital's discharge process. What, as a CNA, which response would be appropriate? Yes, everybody, the importance of follow-up care. Look, Mr. Doe is going to need cardiac rehab. Mr. Doe's family is going to have to help him adhere to a heart healthy diet. So it's going to be a lot of changes to prevent another arrest. So the correct response is C, the importance of follow-up care. And follow-up care is crucial for monitoring the patient's recovery and preventing future cardiac arrest events. Number 15, why is it important to involve the patient's family in the care plan? A, to ensure they understand the patient's condition. B, to reduce the workload on healthcare staff. C, to provide emotional support to the patient. D, to prepare them for home care responsibilities. We provide holistic care. We're just not taking care of a person who has had a cardiac arrest event. We take care of them and we take care of their families. So, CNAs, what's the best response for question number 15? Ruth and Linda Grace. Yes, we have to prepare the family. Look, he can't be eating fried chicken. My mom wants some fried chicken so bad. She can have some baked chicken. So the answer is going to be D, prepare them for home care responsibilities. Family involvement is key to ensuring a smooth transition to home and continued recovery. Question number 16. What should be included in discharge instructions for a patient who has had a cardiac arrest? And remember, this is, for this one, it's all inclusive. So is it A, dietary restrictions, B, medication schedule, C, follow-up appointments, or D, all of the above? So this one is related to the entire team, just not the CNA. What do you think should be included in the discharge instructions for Mr. Doe? And everyone's getting this right, all of the above, because our job is to help him and his family prevent another cardiac arrest event. So all of the above is correct. So comprehensive discharge instructions should cover diet, medications, follow-up care, safety, fall precautions, anything you could think of. If he's on blood pressure medications, don't stand up too quickly because you're going to get dizzy. So all the stuff you hear us saying in the hospital, as you're putting him in the wheelchair, you're going to keep saying the same thing over and over again so that hopefully it sticks. And when he gets home, he just won't stand up too fast, get dizzy, and then hit the floor. So you keep educating those patients as you are helping them with their daily task. Number 17, how can nursing assistants support the patient's recovery after discharge? A, by providing medication treatments at home. B, by encouraging adherence to the care plan. C, by making follow-up appointments. D, by reducing the number of visitors. And everyone should get this one correct also. I'm so proud of you all. You all are a great team. And now I'll be revealing this answer in 3, 2, and you all are correct. The care plan talks about the diet, low salt, the activity, get out of bed with assistance, use your cane. So that would be part of those instructions that you want to encourage the patient to continue even once they're out of the hospital. So nursing assistants play a role in ensuring that the patient follows their prescribed care plan for optimum recovery. Number 18, what is an important sign of potential complications after cardiac arrest that should be reported immediately? Is it increased appetite, difficulty sleeping, shortness of breath, or increased energy levels? And think about what I said was the priority with nursing care once a person has a pulse. Yes, because you all remember those ABCs: airway, breathing, circulation. So the correct response is C. Look, Mr. Doe went without oxygen for a while. He had a cardiac arrest event. He has to go through cardiac rehab. If he's outside, look, right now in Florida, it's 100 degrees. So he cannot be out here at the ballpark. He cannot resume his normal activities immediately. If he start having shortness of breath, that could indicate a potential complication, and it should be reported immediately. He should be notifying his doctor for an assessment, because that means that his heart may not be pumping properly. And I am so proud of you. Mr. Doe is feeling better. He is looking better. He has completed his cardio rehab. And because of you, you recognized the symptoms of sudden cardiac arrest. You alerted the nursing team. You started CPR. You monitored his vital signs. You checked on his neurological status. And you reminded him and his family about his new heart healthy lifestyle. Did you know you can do all of that in a couple of hours? Yes, you did. And so, great job, lifesavers. Look, I love you. I appreciate you again. For everyone who said a kind word, who prayed for my mother, who prayed for me, I just want to say thank you. And now that she's getting better, I will try to come back on here at least 3 times this week with new scenarios. I know we have to do a scenario on C. diff. We have to do a scenario on stroke, definitely, since my mom had a stroke. So you all be learning a lot, not just about test questions, but about the whole process. Because again, when you go into the hospital, this patient just isn't one question. It's a whole patient that you're going to be caring from start, from the initial admission all the way to the time they're discharged. So you all, I love you. Enjoy your Sunday, and I will see you in the next video. Bye, everybody. I love you too.